There is a biblical saying that says, "Pride goeth before a fall." This video is about the eye, and I thought I did a pretty good job until I reviewed it. And then I noticed that I kept saying vestibulocochlear nerve, cranial nerve number 8. That goes to the ear. Cranial nerve number 2, the optic nerve, goes to the eye. So every time you hear vestibulocochlear nerve on this video, I should have said optic nerve. An optic nerve is cranial nerve number 2. I'm also going to make a recording so that I can splice it in, that whenever I say vestibulocochlear nerve, it'll intervene and say optic nerve. So I'm sorry for that, but I don't feel like making the video over again. I'm a very lazy person, as you may have noticed by now. Thank you for your kindness in watching these videos. I hope you're doing well in the course. This video is about the special sense of vision, and this of course is a model of the eye. So let's look at what we can see about the eye. We want to know on the posterior side that this big nerve going into it is cranial nerve number 8, comes out of the brain and goes into the eyeball. It's the vestibulocochlear nerve. That's the vestibulocochlear nerve. This not optic nerve, cranial nerve number 2. This outer layer around the eyeball is called the sclera. And then the middle layer, which you can't see, is called the choroid. And then there's an inner layer which is called the retina. So the layers of the eyeball going from the outside to the inside are sclera. That's what you're seeing right there. The middle layer is choroid, and the interior layer is the retina. Okay, so now these big muscles we see, and there's 6 of them, they're not all showing on this model, but these big brown things are the extrinsic eye muscles, muscles that move the eyeball around in the socket. There is a rectus muscle superior and inferior, a rectus muscle lateral and medial, and then there is an inferior oblique and a superior oblique, so you can look at an angle. That's what those obliques for. The medial and lateral just move side to side. The superior and inferior move up and down, and the obliques can look on an angle. See? So those are the extrinsic eye muscles. Okay. Now this first layer on the outside that you see here, we're going to take the eyeball apart in a minute. That's called the cornea. That's called the cornea. So let's go ahead and take it apart right now. Let me put it down like this so you can see. The first thing I'm going to take off is this part. That's the cornea. See? That's the cornea. And then the next part is the iris. That's the thing that can get bigger or smaller to change the opening. The opening is the pupil. The opening is the pupil. See? And this around it, that's the colored part of your eye, the pigmented part. And it can constrict or dilate that pupil. Okay, so this is the iris. Now there's one more thing. The space between the cornea and the iris is called the anterior chamber. Okay, the anterior chamber is between the cornea and the iris. Okay, so now let's take the iris out, and what we see beyond the iris is this part right here. That's the lens. That's the lens, and the lens is from the iris to the lens is called the posterior chamber. The anterior chamber and the posterior chamber make up the anterior compartment, which is filled with aqueous humor. That's the fluid that's in there is called aqueous humor. Okay, so let's see what we have so far. The anterior chamber is what? Between the cornea and the iris. That's the anterior chamber. And between the iris and the lens is the posterior chamber. Now we really want to get it complicated. The anterior and the posterior chamber make up the anterior compartment, and the anterior compartment is filled with aqueous humor. Now we focus light onto the retina. We'll be looking at the retina in a minute. We focus light onto the retina by changing the curvature of the lens. Let's pop that lens out. Okay. And the lens has suspensory ligaments. A bunch of them have been broken off, but they go all the way around that lens. And that suspensory ligaments attach that lens to a ciliary muscle. We'll see it on when we go into the eye, to a ciliary muscle. And it can pull on that lens when that muscle contracts and relaxes, pull it to change the curvature of the lens. So when it pulls on it, it flattens it out. When it relaxes, then it gets a greater curvature. So the way that the lens focuses light onto the retina of the eyeball is by changing the curvature of the lens. Okay. Now this big thing coming out here, this is the posterior compartment. The posterior compartment, and the posterior compartment is filled with vitreous humor. It's a jelly-like substance. So now to make it real complicated, there's an anterior compartment which is made up of what? The anterior chamber, and that is in front of the iris and between the cornea and the iris, and then the posterior chamber, which is between the iris and the lens. And the anterior chamber and the posterior chamber make up the anterior compartment, which is filled with aqueous humor. This is the posterior compartment, which is filled with vitreous humor, a jelly-like material. Okay. Then if we take the eyeball right here and we look, let's see, get it oriented like this. See all this brown is muscle tissue all around there, and that muscle tissue is the ciliary muscle tissue, and it pulls on those suspensory ligaments to change the curvature of the eyeball. Okay, and so that's how it focuses light onto all this on the inside. Remember, the outer part was called the sclera. The in between is the choroid, and the inside layer is the retina. The retina has photoreceptor cells that receive light, turn it into a impulse of a nerve impulse, and send it back to the brain, and it goes to where? To the occipital lobe, to that visual cortex on the occipital lobe, so you can see. Okay, so that's the retina. And then also you see coming in here, that's cranial nerve number 8, which is the vestibulocochlear nerve. Okay, not optic nerve, cranial nerve number 2. So let's just go in reverse and put the thing back together. This is cranial nerve number 8, the vestibulocochlear nerve. Not optic nerve, cranial nerve number 2. Lining is called what? The retina of the eyeball. It's photoreceptor cells that turn the light into nerve impulses. This muscle around here is the ciliary muscle. Okay, now we're going to pick this up. This is the posterior compartment, which has vitreous humor in the jelly stuff. Okay, and now we're going to put in the next thing, which is the lens, which has suspensory ligaments around it. Then we're going to put in the iris and the pupil. Remember, the iris is the colored part of the eye, and it constrict and dilate the pupil. The pupil is just a space. And then in front of that is the lens. Okay. Get that in there. And then put the other half of the eyeball on there. And what we saw from the outside coat is called the sclera. These are the what? Extrinsic eye muscles. The intrinsic eye muscle are the muscles in the eye. That's the ciliary muscle. These move the eyeball around in the socket. And then finally, here is the vestibulocochlear nerve, the 8th cranial nerve, going into the eyeball. Not optic nerve, cranial nerve number 2. So as Humphrey Bogart said in Casablanca, here's looking at you, kid.